Hello, everyone. Good afternoon, wherever you are, morning, evening, wherever you are in the world, and you're welcome to this show. My name is Dr. Shola Olokere, and I'm standing in here as your host today. Um, Hopefully, you will have a great show. We'll be discussing important things like we always do on this Black Mental Health Matters show. The aim is to educate us and also provide information around awareness in terms of mental health and emotional well-being. So, this afternoon, this wonderful afternoon where I have the pleasure of speaking to a very, very important person who is very, very knowledgeable. And I'm hoping, as well as hosting this show today, I will be learning a lot as well onto how this important topic affects us. So this afternoon, we'll be dissecting it right from causes to how it presents and the cultural differences and how it affects us, how it links to faith, what are the services available. And today the topic is psychosis. But before we go further, I would like to introduce my honorable guest that I've got in the house. It is no other than the world famous Honorable David Naboare. I'm not going to read out your intimidating and impressive profile, but I'm just going to say a bit about you. This is a gentleman who lives and breathes mental health. He is extremely dedicated and passionate and about this cause. He goes above and beyond to educate people of his community in Ghana and even internationally, speaking at various events and impacting knowledge day and night via the interviews, seminars, and clinical practice. Over the last year, I've been very proud to be associated with you and what you stand for, and the fact that you are always willing and readily available to impact knowledge. So this afternoon, we'll be learning from you. Hi, David. Can you introduce yourself to my guest again, please? Thank you.
Yes, thank you very much. This is Honorable David Nabuare. I'm a Ghanaian, African. I serve the world. Yes, very few things that I do. I am a mental health advocate and professional. At the national level, I am a member of the Coalition of NGOs in Health. I am also the national president of all mental health officers in Ghana. I am the Director General of Nabore International Institute for Mental Health Studies in Africa and the Chief Executive Officer of the Nabore Foundation. Yes, there are other organizations, and I'm a member. The Ghana Mental Health Advocates, I'm a member. Favor, it is a depression awareness platform, I'm a member. I cannot finish mentioning all. Yes, all that I just want to tell our members that we have them here so that we could divulge some informations with our cherished host and also our dear viewers to learn issues on mental health. No other topic psychosis, almighty psychosis. And today we will take our viewers on the memory lane, what they're supposed to know, where they're supposed to look for help. What are some of the things that brings about some of these things? Yes, at the community level, our cultural issues, and so on and so forth. So they should expect a very wow presentation from the two of us as we go into today's important engagement with our viewers across the world. So wherever you are, good morning, good afternoon, good evening, good night to everybody.
Thank you very much, Honorable David. And I'm very, very pleased to be here today. We have people listening to us from South Sudan, from Canada, from Kenya, just across the globe. And as you said, our main purpose for this show is to provide information about awareness. And that is why I really praise what the organizers of this show are doing in terms of impacting knowledge. We have to take it and take ownership of this. And that is why we're coming here and spending our time every Saturday to talk about how we can help our people to be able to identify symptoms and get help and eradicate the stigma generally. But without any more perambulation, I want to start by saying, Honorable David, can you please tell us in terms of definition or concept or what we understand by, because it looks like a big topic. It might not be big for me and you because we're in this field, but for our listeners, can you please tell us what you mean by psychosis?
Yes, we want our listeners to know that when we talk about psychosis, it's an abnormal condition of the mind, and it describes or it involves the loss of contact with reality. So people experiencing psychosis may exhibit some personality changes, some may have thought disorders, some may have some delusions, some may have hallucinations. When we get into the main issues, we will break some of these terms down. Then, depending on the severity, some patients who may have some unusual, bizarre behaviors, as well as difficulty with their social interactions and impairment, thereby carrying out their daily activities, will be hampered. All that I just want to let our viewers know is that when we talk about psychosis, it's one of the major psychiatric disorders that we have, and it has to do with the human mind. When someone has psychosis, the person lose contact with reality. His personality, it changes. He also have problem with his or her social interactions, thereby how this particular client or patient is able to, should I say, go about his daily activities are somehow hampered. So in this regard, you are going to see a patient or a client having problem with some of these things that I have just mentioned. The way he used to bath, the way he used to go to work, the way he used to associate with people. All these issues will be curtailed, and the patient or client will have problem. When they have problems, some of them will begin to tell you that they are hearing voices. Some will begin to tell you that they feel like somebody want to kill them or they should kill somebody. These are some of the things that we see from some of these patients. Per definition, I think our viewers should know that it is a major psychiatric disorder that involves the human mind. And when the human mind function is implicated in terms of its normality, we therefore have patients or clients that experience some of these bizarre symptoms, some of these untoward behaviors that they go through. Thereby, you see most of them behaving otherwise instead of going on with their activities normally. So this is what I have on the definition, just to let our viewers know on the fundamental basis that this is what psychosis is about. So when I move further, when we mean psychosis, it is a cluster of conditions that we look out for in psychosis. So I know when we get there, we'll let our viewers know what actually is embedded into what we're looking out for in terms of psychotic conditions or types of psychosis. But before then, we'll be looking at, probably as our moderator and host will be taking us through, there is a presentation outline of which you will take us through. So just to add up, about 1% of the population, the entire world population, is likely to be suffering from psychosis. And when I look at some statistics from the United States of America, about 3% of the US population is having psychosis. And this is a very, very difficult situation. Then when you take the proper psychosis with our pregnant mothers who have just delivered, 2 out of every 1,000 per statistics. But in terms of what is happening in some of our geographic locations, I think these numbers are far, far above what we've seen in some statistics. So these are some of the things we want viewers to know, that we are not just talking about psychosis, but we are saying that the condition is there with us in the community. Therefore, we should look out for the number of people who are affected. And it is about our human mind, the way our mind functions. So people behave otherwise in terms of their normal function. Most of them have psychosis. But who then tells who have psychosis? It is from we, the professionals, who can put the criteria and the standards to come out with a possible diagnosis to put our client onto that line of this diagnostic, should I say, condition. So we don't just expect our viewers and whoever gets this video to say that because of what we have said, they can just call anybody that you have psychosis. Until our assessment and evaluation comes out with our findings to clarify. But with these basics, signs and symptoms we have outlined, you'll be able to know that I am suspecting. It is an alleged, so an allegation. You are coming with an allegation. It is therefore left with Dr. Sola and myself and other professionals to come out with what we know on psychosis, looking at our diagnostic criteria that we have. Either you are using the DSM-5 or the ICD-10 in your diagnostic protocols. Thank you very much.
Wow. Thank you very much, Honorable David. And as I said earlier, our viewers, you are in for a very informative and educative time today. But before we go on, you've said a lot in that explanation of the definition concept. I want to ask you one or two questions. First one is, can you just tell me and our viewers, this psychosis, does he have any age preference? Is he male alone? Is he young? Is he old? Is he only man? Is he only woman? Or anybody?
Yes, in terms of the entire population, all forms of mental illnesses, of which psychosis is not excluded. But when we are looking at the psychotic conditions, most mental illnesses begins at the ages of 15 to 29. And when you look at some of the psychotic conditions that we are having, most of the young ones suffer from psychosis. So per this very information, psychosis most at times happen to affect the youth or youthful ages of our very population. But in terms of gender balance and stuff, most of the times the males stand a higher chance than the females. But when you are also looking down, when we talk about puerperal psychosis most of the times is for women and not men. So depending on the specifics that we are looking at now, so everyone is prone, but the youthful ages are more prone. So we are saying that our population of 15 to 29 years are prone to getting most of the psychotic conditions. And this one, when we look at the ratios and the numbers, the males stand a higher chance, because in my clinic and even my country, we register more psychotic cases in males than in females. Yes, and I know in other literatures and other researches I have read, most males are affected in psychosis than in females. But we have to look at the specifics, because when you are talking about depression in pregnancy, of which some psychotic symptoms are part, you know, a man cannot get pregnant. So this is where the dichotomy now comes. Thank you very much.
Thank you very much. Thank you very much, Honorable. So what you have, so if I could just summarize that most times is in the youthful age, commoner in males than females, but anybody can get it. But still on that topic, on this causative and causes now, can you please tell our viewers what are the things that can cause it or can predispose people to it? Because you've said psychosis is a major mental disorder. They want to know what can cause it and how can they prevent things like this. I think it's very, very important which we share that with our viewers today.
Yes. Doc, thank you very much, and I'm most grateful for this very question at this moment. Yes, before I come to the causes, I want our viewers to know that when we are talking about mental illnesses, of which we are singling out psychosis, I want our viewers to know that when we are talking about psychosis, let's look at the part of brain that is implicated. I mean, which part of our human brain that is affected? It is the limbic system, of which we have some parts of our brain control emotions. Yes, so they should just look out for, and there are some other neurotransmitters that are implicated in psychotic conditions. Dopamine is one, serotonin is two, norepinephrine is three. And all these things all are part, they all cumulate to the causes of what.
I think I lost Honorable there. Honorable was just in the process of giving us a lot of anatomical.
Moving forward, the causes of
Go on. I lost you a
All
bit there, but you can
forms of
continue.
mental illness and psychosis, to be precise today, we have an internet, shall I say, interaction. All forms of mental illness, of which we are talking about psychosis today, the very first one, when you are looking at most standardized literature, some books will tell you the cause is unknown. But besides that, there are other predisposing, precipitating factors. Some books put them into major points of which we are going to look at. So the causes of psychosis, as we are talking about, of which I know we'll be coming to look at the various types of psychosis that we have one, genetics. So if your father, your mother had psychosis, or your grandfather, your likelihood of having psychosis, it's very high. It means this condition can run in families. Therefore, we should be very, very careful when most of our relations have psychosis. Number two, we have trauma. We know the various part of the brain controls its functions, and even at birth. That is why it's always advised that we give birth at the hospital. If probably this baby being born is not brought out well and the head knocks the ground, or maybe during his or her developmental stages, some major trauma happens to those part of the brain. Later in life, that child could suffer psychosis. And even we as adults, if you are hit at a point that you are not supposed to be hit, later or even immediately, I have even nursed patients who have had several, should I say, accidents as a result of concussions, and they start to have psychosis. Yes, we also have psychiatric disorders, of which we have various forms that are implicated, of which some, that is why I say when we are talking about psychosis, it is a universal. There are subsets of it, of which most of them brings about the psychosis. We cannot look at this without looking at some conditions like bipolar disorder, some conditions like drug-induced psychosis, peppral psychosis, just to mention a few, because I'll come to the various types. We also have psychoactive drugs, of which my emphasis is on. Of late, World Health Organization has told us that each year, 3 million people every 10 seconds, someone die out of substance use disorder or alcohol abuse. So you can see that our population is exposed and has been affected with substance use or psychoactive use, which are alcohols, heroin, marijuana, and those stuffs. And some of these things in our body, we know what they contain. The nicotine and stuff go straight to that part of the brain that controls the way our emotions and stuff should be, gets those centers implicated. And most of our clients who are on substances have psychosis at the end of the day. So psychoactive drugs that our people or the population use have brought most of them to suffer from psychosis. Not mentioning there are other forms of medications that when you take them, they can implicate you in that regard. So I just want to tell our viewers that besides all this we have mentioned, as I earlier on said, it could happen for no apparent reason that you could have psychosis as well. So it is a condition that has been with us since history. And I think most of the great leaders who have suffered from some forms of mental illnesses, when I read on them, the other time I took time to read about close to 10 of them, I got to know that some of the conditions we have being captured under psychosis, most of the great leaders suffer from those conditions, and most of them had psychosis in that regard. So moving forward, looking at psychosis, we cannot just talk about psychosis without looking into what is contained in that particular basket that we are looking out for in the brain. What conditions, what are the types of psychosis? I know this was what my host wanted to ask me, but just to move on, the types of psychosis, we have schizophrenias, they are there. And when we talk about schizophrenias, I will always say that we have schizophreniform, schizoaffective. We just want our viewers to know that schizophrenia is a form of psychotic condition. Thereby, patients who have schizophrenia, they have problem with the way they have perception and the way they have their thought. Therefore, they have
I think lost Honorable David there. While we're waiting for him to connect, he was just going into and
delusions
checking.
and
Okay, go on.
hallucinations. And some of them also, some in some cases, could have illusions or psychotic components. So these are the types of psychosis I want our viewers to know that there are a lot of
Okay, as well,
conditions
Honorable
that
David is
play a
trying
part
to,
in
network is trying to
psychosis.
reconnect back. We're just
Yes,
going on to, okay, go on.
some may also experience. Can you hear me?
Yes, I can hear you. I can hear you. It's better
Yeah,
now.
some could also experience illusions, that is misrepresentation of objects. So some of the patients, instead of them seeing a belt in their room, they see the belt as a snake. Yes, and some of them, maybe the noise or the sound of a motorbike, some of them could tell you that it is an aeroplane. Yes, they have misrepresentation. Yes, these are the things we are looking at. We also have drug-induced psychosis. It is a form of psychosis. So people who are on substances, they have drug-induced psychosis. And persons who are also just delivering, the women, our pregnant women, they have puerperal psychosis. Then we also have psychotic depression, a depression that have some psychotic components. So these are the types of psychosis I want our viewers to know that as we are talking about the bigger picture, these are the various types of psychotic disorders that we have. We have schizophrenia, we have bipolar disorder, for which mania and depression is combined. We also have psychotic depression, we have schizoaffective disorders, of which I was saying that when you're looking at schizophrenia, there are various forms, and schizoaffective is also part or is one of them that has been inflicted, or that is a type. Then the puerperal psychosis. So our viewers will know that there are a lot of conditions that play a part in psychosis, not less than 6 or 7. And even you could be seeing some other conditions, and you could see that your patient could be having some psychotic, should I say, signs and symptoms. So we must look out for that. So our viewers, most of them are watching us from far and near: United States of America, Canada, Jeba, that is South Sudan, Kenya, Tanzania. We are most grateful that Black Mental Health Show is one of the shows you have the experts divulge information on mental health. I know we'll be coming to our catch-up perspective section for professionals who have taken to the hill to, should I say, campaign, create awareness on issues regarding mental health and mental illnesses. And today on the show, we are handling psychosis. Thank you very much, my host and all
Wow.
viewers.
Wow, wow. I was enjoying it and I was just keeping my eye on the time. And wow, this show probably will need to be extending it to up to 2 hours now because there's just so much to talk about. But you listed those types of psychosis now, and I just want us to take one or two of them and go into it a bit more. So in my own practice, and among the teens and early adults, because we said this is common around 15 and above age. Use of illicit substance is a problem, is an ongoing problem. And you hear people say, oh, I use it because it helps me sleep. I use it and I don't have any side effect. I just want to shed a bit more light on drug-induced psychosis part of it. And what advice do you have for my people listening?
Doc, can you come
Honorable, did
again,
you get my
please?
question? Okay, so my question is
Can you
about
come?
drug-induced
Please, can you
psychosis.
come again?
It's about drug-induced psychosis and how a lot of people are using a lot of
Okay.
drug illicit substances from cannabis to cocaine to marijuana and a lot of some say it doesn't do them anything, while some it affects them. What advice and do you have for people at home listening to this?
Yes, most of the cases we have coming from the youthful perspective are from this drug-induced psychosis. So I can say that over or about 50% of our youthful ages who report to our centers for support are as a result of what I am terming drug-induced psychosis. So I am just saying that looking at the current situation we find ourselves with a pandemic, it will be very hard for us to eliminate mental illness totally. But we can also help the community in ensuring that we beat psychosis mental illness.
Just as Honorable was mentioning issues around the pandemic, and it's the presentation today would be incomplete without us linking these people's experiences with the pandemic. And I work in a community mental health service, and we part of my patients have got underlying psychotic illness, and during this period of isolation and stuff, it is probably make their symptoms slightly a bit worse because they are slightly more anxious, especially
Can you
because
hear
they're
me
not
now?
able to go out and they're not able to.
Can you hear me
Yeah,
now?
I'm hearing you. I'm just. Yes, I can hear you now. I can hear you now. Go on, Honorable. I was just talking about how COVID is making a lot of people anxious and people that have underlying psychotic problems, or and also people that are being locked down in one place
So
or the other are
yeah,
taking to drugs.
regarding the substance-induced psychosis, yeah, I want to say that
Yeah, go on, Honorable. We're listening to you.
yes, please. Yeah, so it is a condition that is of late adding up to we having most of our psychotic cases or psychosis being reported at our outfit. So my advice is that we, the young people of this world, I know people are watching us across the world, should desist from the use of psychoactive substances such as cocaine, heroin, ecstasies, marijuana, and the alcohols. All those substances do not help us. They rather compound our problems and make some of us suffer from some of these conditions. So I would say that most of our psychotic cases that we have, substance induced, are very, very high. So our young people should take care of themselves. They should help us in the creation of awareness, and they should also help us in ensuring that we beat psychosis and mental illness to the barest minimum. I know it will be very hard for us to eliminate mental illness totally, but we can all support to campaigning against some of these things, and we will not be having the younger population suffer from some of these conditions as we moving forward into we engaging a larger population like on the Black mental health matters should, which we have been hearing since last year. So we begging all of them to support us in this particular campaign and stop. And if anybody is into it and want to stop, I know that our consultants, psychiatrists, other professionals of doctors in psychiatry and psychologists, mental health practitioners are available to assist them. So they should come forward for us to also help them in terms of recovery and rehabilitation. It is possible you can stop if you are into substance use, and it is possible you can also help us in the advocacy and the campaigns. So this is all that I have for them at this time. They should help us and they should stop the consumption of those substances. It wouldn't help their brain. It would rather let them get psychosis at the end of the day. Yes.
Thank you very much. Thank you very much. Just to follow on to that question, that answer, that wonderful answer you gave me, I just want to find out. Where I'm from Nigeria, and you are you're Ghanaian. What impact or what role does our culture and our faith plays in us talking, especially mental illness as a whole? What role? And you've correctly said that psychosis is a major mental disorder. What role does our faith and culture play in accessing to services, in people getting help and eradication of stigma?
Our culture has been one of the things that most of us have been talking, that it has actually affected us in terms of helping to curtail this mental illness and also psychosis. So I will always say that most of our people, when they have some of their relatives suffer from psychosis, all that they think is that it is as a result of his bad deeds and evil spirits. So we have the view from the professional perspective is that even now in major cities that psychiatric services are available, they see some clients who suffer from psychosis that they are having evil spirits. Therefore, they should send them to the shrines, they should send them to the prayer camps, and so on and so forth. So our culture and the way we do things, I will not stand here to speak against our culture, but I am saying that some of the things that we at times adopt and at times use in terms of managing the mental ill in our communities has not helped us enough, because most of them could have gotten the support from us and would have been better. But because of our cultural perspective, we relegate most of them and they become vegetables, even wandering about without relatives. But I tell you that I meet people, I know that they have even families, but because they have mental illness, they desert them. So I'm begging and pleading that our culture, some of the aspects in terms of how some cultures on the African continent see to the care of the mentally ill should be relooked at. And our chiefs, our queen mothers, our community leaders who are in the helm of affairs in terms of our culture, values, and norms should sit on a round table, review some of the norms, and see that if I am the chief and I suffer from mental illness today, should the entire community disown me? This is just a simple question that I always ask when I get a platform. As well as if you are the assembly member, you are the politician, you are the so and so, should you be disowned if you have mental illness? No. So our cultural values are very instrumental when it comes to the care of the mentally ill. Notwithstanding, some faith-based healers have also contributed to supporting mental illness and mental health. In some geographic locations, some of us find ourselves. What do we do differently? All that we do is that we avail our services to these faith-based healers. Whether you are having a shrine, whether you are having a prayer camp, we engage you. If you have anybody you think the person is having problem with their thinking, call me as the professional to come and support you. I am not taking away from you, but we shall support each other in the care of the mentally challenged. So most of my cases, I'm even receiving them from the pastors. Yes, I'm receiving them from some prayer camps. So it is about collaboration, but we must also make ourselves available. Some even online, they can video, send me some of the symptoms the patient is exhibiting. I look for the professional around that location to intervene if I cannot go. So services are readily available and we can come in at any time, but our faith and our culture should be something that we look at very critical. Most pastors too, some are coming up, some still want to go the spiritual way. Most of the things that happen are not spiritual oriented. They are from the human mind, of which psychiatry and psychology must intervene for you, the pastor, to continue with your spiritual aspect. I am not saying not all issues can we stand here, because science is what we are dealing with. But what you are handling there in terms of spirituality and theology, we cannot talk much on that. So I will plead that on this platform, all our cultural leaders, all our faith-based leaders should let us join hands and be able to support the mentally challenged. Let's all join the campaign. I know if policies can be generated from the community to help us promote and create more awareness. Yes. So these are some of the things I am looking at. Yes. Someone was saying that some people who are into some aspects of some professions like boxing and stuff, we have some couple of such people here. They used to have knock on their heads and stuff, and some of them do have psychosis at the end of the day. So your profession should also be looked at. Yes. Unfortunately, these are some of the gaps that we are having. I know, Doc, we are all engaging ourselves in this particular perspective to look at what actually is hidden. Most of our community members to hide the patients from the public. It took me a year in my community to even identify somebody who was in a chain. So you can see that it is very critical, and we, the professionals, must put up our very best to entering every single home and conducting issues on their mental health. Mental health at the home, on the parents, with the children at the school. This is where some of the cases are. If the child is not learning well, does the child have some of these symptoms we are talking about? The parent, does he drink? The assembly members, those leaders in the community, their behavior, how do you see? Most of them could be having some of these mass symptoms. And if you don't take time, there was a case we managed in my geographic location. This particular patient was to the prayer camp. The other brother, he saw the brother, I don't know, either a threat to him or he hallucinated or he was hurt. So he took a wooden pistol and on the jaw of the brother, he slashed the brother's jaw into pieces. And as I talk, the brother is no more. I was the one who accompanied this patient to the regional hospital. And that actually made me to develop interest for mental illness and mental health. I was in the general ward and I said, no, some of us must step in to support in the advocacy, to support in the care and become advocates, not in our communities, but to the globe at large. This is where my interest came from, because I look at this innocent man whose life brought to an end because of someone's mental illness. That patient, to the police station, he was mentally drilled. What can they do? They left him back to the prayer camp and he started management. But somebody's life has been brought to a halt, just like that. If you see how the maxillofacial bones were protruding, bleeding, we did intubation and stuff. Oh, doc, it's something I don't want to remember, but that actually drove me into entering into mental health as a profession, because I have to support and help the system in my own small way. And now we are having ourselves here gathered as professionals, as viewers, and as people who are concerned on mental health to divulge very key information. Everybody's culture influences his way of life, influences his mental health. Therefore, let us look at the healthy aspect of our culture. Let us look at the ill aspect of our culture, and let us see what we can do differently. Yes, when I spoke about hallucinations and those things, people see other people differently. This was what the man did to the brother, and hear voices. So maybe I am with you now as my professional. I can see you as someone who is holding a gun coming to kill me. So I must attack you and defend myself. Yes. And some of them could be hearing voices commanding them that go and kill this person, go and do this. Yes. So these are the things most of them have in their brain. Yes. And it also can come about as a result of other conditions. I am in nursing training now, lecturing, and I am even handling some conditions like general anxiety disorder. And you can see that some of those conditions, we have some component of psychosis in them, looking at the symptoms patient present. So not only in psychosis and other in the specific types, but other related conditions that the human mind is implicated. Even when you look at the anxiety conditions, you can see that the amygdala, that is the limbic system, most of the structures, the dopamines and those things, which influence the way we used to interact, the way we become happy, sad, and those things. It is also called a happy hormone. Yes, all those things are affected, and we must look out for that. Yes, we had earlier on mentioned that we call it we, and every geographic location know a specific name. Some call it Jah, God. Some call it we. Cocaine and those things all are issues that have muddied our waters and have even put us on the disadvantaged side. So what do we do? All that we can do is that these things all bring about psychosis. So we must all step up effort. Our cultures can even enact laws at the community level to ban people who smoke these things, and those who smoke them, they can charge them for maybe committing some crimes against humanity and those things. So let's look at what is ahead of us in terms of our advocacy. I know on these platforms, in terms of treatment and stuff, we'll be looking at more on prevention. So prevention start right from the family level. Yes, we have to look at as a couple. Yes, I just thought yesterday, and I told some of the students that it will be necessary when you're going to marry or when you're going to have a child, you must look at
Are you there, Honorable David?
Yes, assessment is very necessary in terms of psychological or psychiatric assessment. Prior marriage, it is very key. Yes. And
Thank
we
you
want to
very.
also say that our president of Black Mental Health Matters, in the person of Dr. Onati Makiweni, is here with us. And congratulations.
Oh, Honorable David just got disconnected there. I'm sure it would be back. Wow, it was just talking about culture and how the faith affect our mental health, and you really raised very, very important issues there, which I just want to further buttress. Yes, it's good to be religious. It's good to belong to a faith, but some things just requires professional intervention. And when we get to treatment, we'll be talking more about psychological intervention. And there's no reason why, if you're experiencing psychosis, you cannot be praying, or your pastors be praying for you, and be engaging with treatment at the same time, psychological intervention or medication. The combination of the two will do you a whole good of a whole lot of good. So it is important. I think the most important thing that David was trying to say was that we should allow people seek help. We should not hide this thing in our community. The culture of hush hush and locking people up and don't preventing them from speaking up. We should try to eradicate that, because help is available. I just sit down there and I dream. I have a dream of when the Black mental health community matters community will have our own thing. We will have our own platform whereby people will be able to access services. We have our doctors, we have our psychologists, we have our community outreach workers, so that people from our background will be able to access this freely. And this will further encourage them to speak up. So I hope that dream will come to fruition one day. I'm Dr. Onati. You've got a big job in your hand to get this sorted. So hopefully together we can impact lives and create and continue to do a lot of awareness, because I think that is the most important thing anyway. A problem known, once you know there's a problem, then that's the first step in getting a solution. So all the symptoms that Honorable David has clearly stated, they are real. It's not making up these things. These are things that people do experience. They lose touch with reality, and as we
Yes,
talked about discussing.
sorry. I had a network truncation, so sorry that I went off. In fact, I am enjoying the talk myself, so I don't know what is happening to our viewers. Congratulations. Thank you very much. Thank you very much. Yes, yes.
Right. So thank you, Bob. You're welcome back. I was just reiterating and summarizing all the things you've said, all the points. I'm just reminding our viewers, and I was just saying about the dream that I have, that one day we will have this platform that all across the globe, the Black community, will have access to our own psychiatrists, our own primary care, our own psychologists, community workers, and this could be easily accessible to our people. If you look at it now, we're doing this on the internet. I'm sure there are some villages whereby they don't even have internet. They can't listen to us. By the time we get bigger and grow bigger, we'll be able to have facilities whereby we have people door-to-door outreach, awareness. I mean, when all this COVID thing is over. And it's a long-term plan, but I think it is doable. We'll be able to make more impact. We are already impacting a lot of people online like this, but we can still do a bit more. And that is why, if anybody listening to us who wants to be part of what we are doing, please, you're welcome. And as we continue to do a lot of awareness in schools, in churches, in mosques, so that they understand that we have moved past that era whereby you keep people somewhere, you hide them, you don't allow them to talk, or you start making judgment or judging them because of their mental disorder. We should be normalizing the conversation around mental illness. We should make people feel comfortable so that they can speak up and support them in any which way that is possible. I want us to have times to go through a bit of questions at the end, but I just want you to tell me, if my brother or sister is experiencing this, how can I support them? One, and what are the treatment options available? 5 minutes so that
Yes,
we can have the last 10 minutes for questions.
yes, thank you very much. I'll be very brief in this regard. Yes, I just saw some people access some very few things. I once shared what we're doing in Ghana with you before, of which you were very happy, regarding mental health care, of which I am the national president of community mental health care. So at your community level, where we find ourselves, what we do is that we engage churches, we engage traditional leaders, all community stakeholders are part of the mental health team. The chief is part, the assembly member is part, everybody is part of the team. So this is where Ghana has gotten to, and it has that I manage right from the chief policies, because I have engaged most of them in my, should I say, treatment, or in my, should I say, community care. And most of them are doing well because they didn't know that such an opportunity could be there. Yes, whether there are treatment options or not, whenever you identify a relative or even yourself experiencing these symptoms that we have mentioned, having some kind of hallucinations, some voices, you are hearing voices, you are at times having some thoughts, probably thinking that you are the president of this country or you are the president of the world. You are at times seeing objects differently. You are seeing people as chasing you and those things. Don't sit down. All that I will say is that don't sit down. Look for the nearest psychiatric unit and report your symptoms. You can also reach us online. I know members who are watching us will be getting the opportunity to our emails and reach us online. I will be able to help them. The mad ones, I know some psychotic conditions at the initial stages, but the brief ones, of which I know I have been managing, on those brief episodes, it will be necessary that you go to the facility of which you can be rapidly tranquilized, because some of them, they need emergency medical or emergency psychiatric services, because most of the psychosis, they happen they have acute episodes. So we should be very careful on that. So the treatment options, I cannot also say that they should go to the over-the-counter and buy medications. That is not advisable. But when they seek the professional, should I say, individuals, they'll be able to direct them as to which medication will be appropriate, because they are going to monitor them on the medications they are taking to see the progress of recovery. So it is very necessary. So the treatment options are that there are some antipsychotics that we have, but in Ghana, medication readiness is an issue. And I know in other countries that we speak now, be looking at in the future is to ensure that how do we mitigate resources to ensure that our clients have medications all around. I have a platform on, I think I have told you before, on this maternal mental health and emotional intelligence facet. We were there this morning and someone said a 57-year-old could not buy risperidone for a month and he's relapsing. I quickly asked how much. The colleague told me it was 36 Ghana cedis or 35. I sent money for them to buy medicines for this particular old man. So you can see that because of 35 or 36 Ghana cedis, somebody is relapsing. What? Come on. We can do better to support people who are in need. So we are not on platforms to make noise, but we are on platforms to help. And this is what I'm advocating that we can all do. Those of us who can help, take it upon yourself. On your birthday, on a special day, go ask the psychiatry unit, what is their challenge? If it's about medication, get some money for them to buy medications for clients who are on medication but cannot afford. Also visit some of the mentally challenged and interact with them. Send them a helping hand. Show them some love. In fact, when I see some of them and I'm even buying food, I involve them, come join me, eat. I buy food for them because I cannot see my mentor. I take them as my mothers, my fathers, my brothers and sisters. They are me and I am them. I always make this comment. They were once like you and you will once be like them if you are not lucky. So we shouldn't shun them. We shouldn't stigmatize them. So the treatment options are, there are antipsychotics. We have the first generation and the second generation and those things. But can our viewers at any outlet dispense this? That is not done. It should be given on professional advice and judgment. So medications and treatment are there for psychosis, but you need to get to the mental health unit to
Thank you very much, Honorable David. I think we lost you a bit. It's trying to connect back again.
Yes, so I'm just saying that the treatment options are just what I have mentioned, antipsychotics to manage psychosis. So, and we should also look out for our pregnant women too as well. When they are about delivering, The men should support them, the family should support them, because most of them have prepared psychosis. And it goes a long way to affect the children and their upbringing. And we are here today because our parents took care of us. So we shouldn't just joke with our pregnant women. This is all that I am saying. And I know our community approach to the mental illness and mental health in terms of community care will be shared to every country that would like to imbibe. It was from UK, and I know the UK partners will be happy for coming to support Ghana from 2010 for community mental health. And now we are over 800 to get into 1,000 professionals across the country, serving in hard to reach areas, at times no network. So we support our clients whenever we are called upon. And I think it has helped us a lot. Hardly will you see a case being referred to the regional hospital now. And that is all that we are looking at for. We are looking at the bottom-up approach, not the up-down approach. No. Mental health should be tackled from the fundamentals, where the cases are. We should tackle them from that point before they get to the specialists. Thereby, we will handle them at the barest minimum. If the psychiatrist is in the national capital, will the patient even get the money to reach Accra? No. So this is where some of us are standing for. Thank you very much. And I know today has been one of the best shows for me in the year 2021. Doc, you are most grateful. Congratulations.
Thank you very much.
And to our viewers too.
Thank you very much, David. Thank you very much. In fact, you nailed everything. You said everything. In fact, you're a wonderful person, spending your hard-earned money and supporting these people, making them feel as part of the community. This is very, very important. And you, on a wider scale, you don't have to be a mental health professional or a psychiatrist to show love and kindness to people who are suffering from mental health. So let us all, because they were the ones like us, me and you, and emotional well-being. It is when your coping strategies fail, that is when it becomes an illness. So anybody's coping strategy could fail at any point in life. Life happens. So we shouldn't look at these people and think, oh, this is God is punishing them for their sins or whatever. It could happen to anybody. So we need to come together, support each other, and the world will be a better place. Let's be kind to each other. Let's be each other's brothers keepers. And I'm just going to touch again on the treatment option. I wanted to, it's a bit of, David has talked about medication. Then there's role for psychological intervention as well, especially when you look at relapse prevention. It gives people, it's psychoeducation. It helps them understand what in your own case has led you to developing this, if there is one. For example, drug-induced, could be depression. So they would let you understand by therapies like CBT could help, cognitive behavioral therapy. So I don't want people just going away thinking it is only medication. No, there's psychological intervention, and there's a lot of our community available intervention as well to support people. But this is dependent on risk and symptoms at point of presentation, like Honorable David has said. Yes, this is very exciting. Wow, I feel like going on and on, but I need to read some of these fantastic comments that we've had. We've got people from the USA, from Kenya, from South Sudan, everywhere watching us. And Dr., I'm just going to show some of the comments. Dr. Onati saying, rooting for us all the way from Canada. Thank you, Dr. Onati. Said that Dr. David is nailing it. David always nails it. And someone to say, Pam has been consistent all through. Pamela Campbell from USA, thank you very much for joining. I hope we've been able to give you a bit of information today. Dr. Onati talked about psychosis. David also said about this as well. So I'm just going through. I might not be able to read all the comments, but I will touch on very important one. Yes, John was also with us throughout. Weed is a major problem for mental health. That is correct. David nailed that as well. And because individual thresholds are different, some people might smoke just one spliff and they are all over the place, while some people will be able to tolerate 3 or 4. So you don't copy what you see other people's doing. It is very, 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 very important. So it is very, very important, and you don't do that. It is important that we know that cannabis and illicit substance can be very dangerous for us. So Pam also said environmental causes as well. Yes, this is one of the things I like talking about when I talk about the biopsychosocial model, but it is very, very important. I'm just going to go on and read a bit more comments. We just have a few minutes more. We did talk about hallucinations and how this could be symptoms of psychosis, hearing voices, seeing things that are not there, hearing people telling you to do very one of the common symptoms of psychosis. And yes, Dr. Onati kindly added that psychosis could also coexist with anxiety. Yes, this is very, very, we've had a lot of contribution. Yes, Dr. Onati did say something. Family needs to come up. Family support is very, 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 very important. In fact, the transformation of care that we're piloting in the UK is, we're talking about people doing better in the community, in the environments where they are much more familiar with, where they have family support, familiar faces, people showing them love and care. It's very, very important, and it helps in recovery quickly. So just going through the, so yes, this is another one about education in church, school, churches, mosque, everywhere, grassroots, our transport workers, car parks, anywhere where there are 2 or 3 people. Let's go there, let's share the word, let them know that they can seek help when they're experiencing any form of mental health condition. And we are all set out and committed to eradicating the stigma. And that is why I'm super grateful for what we are doing on this forum. And again, for anybody that is listening and you say, oh, these guys are just saying access is there, help there, there's no help in where I am. Maybe you're in one village somewhere. Just drop us a comment on this our platform or on the Facebook page, or drop, and someone would be in touch with you to support you and give you, and then we might be able to signpost you to somewhere locally. But we will respond. I remember doing an assessment for someone over Zoom the other day, or WhatsApp. But yes, that is what we are here. We are putting ourselves out there to support. We're not sitting down and waiting for government to give us that big money or whatever to before we start helping our people. You too can do your part by showing care and love to your family, to relatives, for anybody that you know that is going through difficult times this period. So I'm just going through the other comments. So we have 4 minutes more. I want Honorable David to kindly just summarize in 2 minutes everything that we have talked about today, and what should be the take-home message for our viewers. Honorable, are you there with me? Yeah, I've asked you to give us the take-home message for today and summary, please.
Yeah. So today we were able. Yeah, we were. Thank you very much.
Go on, I can hear you now. Go on. Just
Can
give
I
us
go ahead?
Yeah, go ahead. Go ahead. Just give us the take-home message for my viewers today.
Yeah, today we spoke on psychosis, of which we said psychosis is one of the major mental illnesses that we have. So when someone has psychosis, he has problem with his perception, his thoughts, and his personality changes, and their social interactions are also hampered. We went ahead to also look at the very part of the brain that is implicated, of which we had mentioned the limbic system and so on and so forth. From there, we look at the various types and causes. So I'll start from the causes, of which we mentioned that genetics is one, of which we mentioned that the psychoactive substance use is also one, of which we mentioned that some of the things that we also have, like trauma, we also have medications, then we also have some psychiatric disorders, causes, or they cause psychosis. From there, we went to look at the types. We have puerperal psychosis, puerperal psychosis, we have bipolar, we have schizophrenia, and we have other psychotic depressions. So just to run up, not only medications can or is available, we have other treatment options like the psychotherapy, of which you had mentioned is the talk therapy. So on behalf of the leadership of the Black Mental Health Show, that is the president
Well, thank you very much, Dr. David. It's been a fantastic show. Thank you very
Mental
much
health
for my viewers.
professionals across the globe. I would like to say a very big thank you today. I am David Nabwari, speaking all the way from Ghana to the world on mental health issues, not any other topic but psychosis in that regard. Today, the 6th day of February 2021 in the year of our Lord. Let's all join the advocacy, let's all join the campaign, and let's all.
Well, thank you very much, Honorable David, for coming on the show. It's been a fantastic time. And my viewers, thank you very much. I hope it's been educative and informative. We'll be here again next week, Saturday, discussing another important issue in mental health. So now, stay safe, keep well. See you soon. Thank you. Bye bye.